the City of Los Angeles has signed an agreement with Honeywell to purchase 24 million N95 masks. We're very excited, and I'm so grateful to Gene and his team for I know what has been weeks of negotiations. These masks will meet our American standards. They'll be produced by a factory in the United States, and we've all seen the headlines detailing the insufficient supply of N95 masks, the price gouging that's going on that is ridiculous for the prices people have to pay, and the way people have been going from vendor to vendor, buying in several thousand from here and several thousand from there. But by buying in bulk and at a low price point that we're very pleased with, we can see the purchasing power of our city stepping up, not just for our workers here in the city, but for our hospital workers as well. Masks will go to first responders and will be distributed at cost to hospitals in need. The first 100,000 delivered in May, 500,000 arriving by July, and scaling up to 1.2 million per month by November. I'm very grateful to our team, to Honeywell, to our General Services Department as well for this life-saving purchase agreement, and to my team, including my Deputy Chief of Staff, Matt Szabo, and others from the City Council who have worked together to make sure we can spend money quickly when we have deals like this to jump on. So let me turn it over to Gene to detail a little bit more, and thanks again for ensuring that our people will be safe and that those who are protecting us in our hospitals will be as well. Gene?
Thank you, Mayor, and very exciting it is. This deal with Honeywell is important on so many levels, but to name three specifically. One, it creates domestic production and jobs only 6 hours away by the 10 freeway. So while others are clamoring to international markets and trying to get in queues here for domestic stockpiles, we have that ability to bring the cargo here to us within hours. Secondly, the idea here is certainty. With the production schedule that the mayor just laid out, we know exactly how much product we are going to receive at a minimum and when. That in turn will give our first responders, hospitals, and frontline medical workers the understanding of how this product is going to come to them and help them in their daily lives. The third piece here is that good price point or the way we want to deliver this, and it's going to be at cost to the hospitals and those workers. The structure of this contract is such that we wouldn't have it any other way. And we thought, built on the great purchasing capabilities and infrastructure of the City of Los Angeles, we could command that in a way that would give the price point a higher level of importance overall. But delivering these products and what we have seen in the marketplace over the last several weeks has been quite eye-opening. The burn rates of these N95 masks, of which we just have an example right here, are upwards of 5 million units per month right here in Los Angeles County. If we add in the private sector hospitals and surrounding areas in our region, that number is soon in 10-digit format. So our ability here now to bring on these masks in the schedule that we've just outlined is helpful. It's not going to complete all the work, but it's a starting point for us. And we'll continue to work to procure more product and get it out there. And that's exactly why Los Angeles created this opportunity through the mayor's vision to have Victory LA in place. And it was to find ways to speed product to market using the great seaport of Los Angeles as well as LAX and our knowledge of the domestic transportation network to make sure we are highlighting and prioritizing these critical shipments to get them to our hospitals. The hospitals have told us they have very little visibility until the last mile of receiving this product. So we've put together a technology platform that coincides with our port optimizer called the Medical Optimizer. And it was simply a plug-in to our larger port system that can now start with purchase order management to supply development and understand where the gap lies in between. That use of data will make the decision-making process that much more quicker so we can get the product directly to market. Some hospitals have told us they need 5 million of these masks just to survive the next couple of months. Others have said their mask usage has grown from 30,000 a month to 300,000. So there still is much more work to do in this area, but it's a great start. And with thanks to Honeywell for stepping up and really working with us, Brent Durham specifically worked around the clock to get this contract done. As we continue down with LoVLA, the work on procuring other products is equally as important right now and continues in that fashion. And this will be the nitrile or exam gloves that you see many of our doctors and nurses using, our first responders. The isolation gowns that are necessary for the medical workers as well as the patients who are being examined, and a litany of other products. So we will continue to stay on this course in purchasing products where we do exactly what we set out. We would add value to the hospital community. We're not going to step over a hospital in the order process. We're not going to push them down in the priority level, but we will be complementary in finding alternative sources of production, just like Honeywell, to come to market quicker. And thirdly, we're still working in the area of converting current manufacturing facilities in California that want to enter into the personal protective equipment market. And there are a number of good stories developing right now with folks who have turned over their production lines, hired back their workers, and are getting products to market again. Very close proximity, not waiting for overseas shipments. So we have a good play here on trying to have speed to market as well as working our traditional supply chain that we're known so well of at the Port of Los Angeles. Next up is matching supply and demand. And with this tech system I mentioned, it gives hospitals now the opportunity to send demand signals electronically to us. And at the LoVLA.org platform, we're matching that demand requirement with those suppliers who have been vetted, not only by the LoVLA volunteer team that now counts 20 folks from downtown LA and our harbor department, but also with the best practices used in the general services department, as well as the business operations center, to make sure that we're checking out everybody we want to do business with very closely, and then we're enabling them to get to work with the needs our hospitals have. In the middle, we're building our LA stockpile. We've commented before that the federal stockpile is non-existent. Unfortunately, the state is so oversubscribed with so many folks looking for help, we decided to go out and do it on our own. So the inventory levels of all these products are starting to build, and we're getting them out to the hospitals. Just last week, we brought 4,000 isolation gowns to Pomona Valley Hospital, as well as the folks at St. Francis and Linwood. These were folks that were going to go out to the store to buy hefty bags, cut holes in them so they could go and take care of our medically ill. Now, the 8,000 gowns that we pushed out are not seemingly enough, but again, it's a good start to help get our medical workers in a safe environment so they could help our ill. And I also want to make sure that we thank those who have donated goods. We talked a little bit last week about the great Apple Corporation, who brought us 160,000 face shields. Shipping giant from Marseille, CMA CGM, has brought to us 3-ply face mask surgical grade. We've also had Operation USA continuing to donate products that we can move out quickly to our hospitals. And Next Trucking, right here in Gardena, hand-delivered face masks that we also gave to our truck drivers, the Teamsters, and so many others in the Harbor Trucking Association that needed help. So lastly, I just want to again say thank you to the Honeywell Corporation for really coming together in a spirit of teamwork to help out the city when we most needed them. There is much more to do, Mayor. I'm very proud of the traction we've created, but this model of going to manufacture and trusted partner as the City of Los Angeles is one that I think we can count on in the future.
Thanks so much, Gene. As always, he impresses me with the work that he does, not just at the port, but here standing this up. And to you and your team, you've really gotten some great victories. These will be lifesavers, quite literally.